So that is it. I am ready for work. I've had my breakfast and off I go. So now that I'm set up, I'm just going through my list for the day. Obviously I can't show you my screen for confidentiality reasons, but it looks like I've got a mixed range of blood pressures, smear tests, a few B12 injections, a denosumab, which I can never say, injection, ECG, and some dressings. So it looks like I'm gonna have a very busy morning. I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 booked in just for this morning. So yeah, but I finish at 1 today, so it's not too bad. So now I know what my list is like. I know that I've got blood pressure first. I'm gonna get the blood pressure stuff ready, and then I know I've got a smear test. I'm gonna get the couch ready and all my smear tests set up. Let's go. So now I'm gonna get all of my blood pressure things ready for my first patient as well. This is the Mercury, the old Mercury style blood pressure machine. I have my own stethoscope from my 2nd year of nursing. This is mine. It has my name on it somewhere. Ta-da! I'm just gonna wash everything down before my patient comes. Clinell wipe. Other wipes are available. New Clinell wipe for each piece of equipment. Just so you know, it's all clean. So for my smear test, you need a couple of different size speculums for your patient, pot holder, a cervical brush. It looks a lot worse than it is, guys, don't worry. So yeah, pot, make sure the date is in date, make sure clear fluid to the line, put it in there, put your brush in there, job done. Then your sample bag, and lastly some information for your patients if they don't know the information. You can give them these. And lastly, sign for the door. Time to put the mask on. Ta-da! Let's do this. Next up we have our B12. Little glass bottles are the devil. So a little tip for you, take your syringe out of the pack, use the pack to open your bottle. Ta-da! So I have drawn it up and ready to give to my patient. So I overran a little bit this morning, so I missed my tea break. However, I did have a gap between patients, so I've grabbed my tea. And yeah, I'm gonna have a quick tea and then I'm on to my ECG next. Next up we have our ECG. I've got the bed ready. ECG machine. 12 lead ECG, which is actually only 10 leads, but it's called a 12 lead ECG because of the 12 points of the heart or something that it captures, something like that. But yeah, this is our machine. We just put in our patient ID and things, which I'm going to do now before setting it all up, and then I'm going to get my patient in. Here we go. This is a sort of semi-urgent referral. This person doesn't have chest pain or anything like that, but their blood pressure is very, very high and they're suffering from headaches and things like that. So the first thing we need to do is an ECG, make sure they haven't got any cardiac issues, and a blood test to make sure that everything in their bloods is good. So things like thyroid, things like glucose levels, things like a full blood count, cholesterol, all the little things that you can think of. Kidneys, oh, how can I forget kidneys? Blood pressure, yeah. All of those little things. So they'll have a full MOT and just make sure that there's nothing underlying causing this really high blood pressure and these headaches, which is never a good sign, but yeah, fingers crossed. So that is ECG done. It was all clear. Good to know. It was all normal. So yeah, happy with that. Didn't have to get doctors involved or anything. So pretty simple. If you notice anything on an ECG, you always get the doctor in to check the patient over and make sure that there's nothing acute happening. Now I have my final patient of the day, which is a wound dressing. I've had a couple of leg ulcers today to do. So yeah, I'm gonna get set up for that. So this is our dressing cupboard. It's got this measuring guide if you're going to be measuring legs for hosiery. We have this guide, wound types, what to put on it, and leg ulcer pathway. And then this is all of our different types of dressings. So today I will need a patient pack, which has your gloves, goggles, and everything in it. This patient has Idoflex, which is an iodine dressing that's quite a squidgy one, so you sort of mold it and then put it into the ulcer. And then this person will always have these absorbent dressings over the top to sort of absorb any fluid that might be leaking out. And I'm also going to be using Prontozan, which is a really good solution if they have a biofilm over the top of the wound. And you'll know it's a biofilm because it'll be like a shiny coating over the wound, and you want to get rid of that and break down the layer so that your patient's wound can heal. And lastly, some of this, which is like a bandaging that's gonna hold everything on. This is, hang on, this sort of bandaging, and that's just going to hold everything on nicely. It's like a tubey grip type of thing. And so this is it. This is me set up. I've got my patient pack, which is my sterile field, Idoflex. Firstly, I'm going to put this on, bit of Prontozan, absorbent dressing, and then that to hold it all on. And Bob's your uncle. And I do have a small confession to make. I'm actually doing this video after my patient has left because I obviously have not got time between patients to do these videos. So this time I've done the patient first, but this is literally all of the setup that I used for my patient. And yeah, they are done and they are gone. And finally, last job of the day, final clear up. Here we go. Don't forget your phones. I've got an issue, guys. My ECG machine won't turn off. Off. Go. Normally it just turns black when you do that. Nothing. Oops. And that, my lovely friends, is a day in the life of a GP nurse. But for now, au revoir.